why are we building hospitals? Why are we not getting rid of hospitals? Because if we were really good at the prevention side and we were really good at staying well and community played a big role in that, we should be closing hospitals.
Especially cancer, people feel like they are really well cared for during the treatment experience. But afterward, when it's over, a lot of them felt kind of dropped off. That's the place where something like art and health can really play a role.
Should creativity be an essential part of patient care, or is it just a nice-to-have addition? My name is Christoph Lindner, and I'm the President and Vice-Chancellor of the Royal College of Art. And I'm thrilled to be joined by two guests today who have committed their research and practice to exploring how creative expression, design, and immersive technology can profoundly impact health and well-being. Camille Baker is Professor of Interactive and Immersive Art at the RCA, where she teaches on the Digital Direction Master's Program. Camille's VR projects, Mammary Mountain and Into Her, use immersive design experiences to explore sensitive topics like the hidden experiences of disease, trauma, and body image. We're also joined by Lottie Barnes, Head of Creative Health for the States of Guernsey. And Lottie champions the integration of creative health into public services and is the artist behind Finding the Beauty in Illness, a photography project documenting her personal journey through cancer treatment. So very warm welcome, Camille and Lottie. And my understanding is that you actually met while working on projects around your own experience with health and creative expression. And so I'd love to start the conversation just by hearing, how did you meet? What were those projects? What brought you together?
So we have a mutual contact who brought us together, actually, Sarah Tico, who's been long working on a project around mental health and also trying to build a network around health and immersive around the UK. And she's a big champion for the role of immersive tech, especially mental health, but more broadly, health and well-being. And Sarah's been really great at pulling me into things because I'm so busy with all the different things that I'm doing, and she's really focused on this one approach and this particular agenda that she's always sort of, when she finds people that might be of interest, she connects us. So Lottie and I met through Sarah Tico.
We did, indeed.
So let me ask a question about health and creativity, because I think there's probably an old-fashioned or maybe outmoded view of how creativity can promote health. And to me, it looks something like you're sitting in a hospital bed, you've just had a big operation or something, and someone puts a kind of sad picture of a sunset on the wall opposite your bed, and somehow by looking at that, it's going to cheer you up and you're going to have a wonderful recovery and get back to your former health. Now, of course, things have moved along a lot since those days. And actually already what I'm hearing in your work is that immersive technologies now have a place in the way that we bring creativity into healthcare, into health spaces. So can you help me understand at the moment in your own work and in the field, how do we approach bringing creativity, art and design into healthcare environments?
So particularly for the program that I oversee, we have kind of two key elements. So we look at creating therapeutic environments. So how can we improve the experience for people being cared for in those spaces, but also for staff. And then also we look at the role of participatory arts. So that might be something like a by the bedside activity or group activity, but ultimately it's about how do we improve the experience for people in a hospital setting is a key part of the work I do. And I think the thing that's really exciting, and as you say, you know, this idea of a very sad-looking painting on the wall to look at, there's just been so much research about therapeutic environments, everything from understanding colours to different kinds of arts. And it's really fascinating to look at different approaches. I actually was awarded a Churchill Fellowship to research the role of culture, arts and nature in healthcare spaces, and I visited 18 hospitals around the US, and it was fascinating to see how different hospitals tackle this. So some believe things like don't include faces in the pictures. Some are like, we just use abstract art. So actually there's a lot of different approaches, and actually all of them have kind of valid reasons. So I think it's very much about developing something that works for your community. So that's very much what we do for the environment. For participatory arts, lots of stuff is happening. This can be anything from things like Dance for Parkinson's, which is a well-established way of working, using dance to support people to stay well, to keep active. What I oversee is by the bedside art activities. So it's about positive distraction. So giving them something else to think about, or sometimes you may have people that have been in hospital for long periods of time and may find themselves feeling isolated. So our artists play a key role in giving them some connection, positive distraction. So yeah, there's a lot to it, and it takes place in different places, from hospitals to community.
And Camille, your background is also in performance. How does that shape the way that you approach creativity in health spaces?
Well, actually, I didn't realize, but I noticed it when I was creating Into Her. And so I created Into Her because I had an ovarian tumor myself, and it was in 2016. And over time, I was going through the health system and talking to other women and trying to understand what can I do to open up the conversation, because it seemed kind of taboo and kind of, insular and hidden. And so the only thing I can do is make something and have conversations with people. And then I started to see similar things when I started working on Memory Mountain. Now, Memory Mountain was inspired because several friends and colleagues and family members were going through breast cancer around the time I was working on Into Her. And so I'm coming from this place of what can I do as someone who's been on the patient side, but also having that researcher mind and thinking, well, there's conversations that are not happening, and how can we open up the conversation? So I don't know if that's from a performer point of view, but from making the work, I wanted to make the work like a mini theater, or a sort of a space that, in both cases, they came from different places. For Into Her, it was much more about making a safe, warm, comfortable space for people to physically enter and then virtually enter, and then to be able to have conversations afterward in a safe, enclosed way. So I made this womb-shaped tent and brought people into the womb. And then for Memory Mountain, in contrast, and working with collaborators, because one of my closest friends had breast cancer, and I pulled her in as one of the artists on Memory Mountain because she's an amazing fashion designer, sound maker, and singer, and environmentalist. Her name's Tara Bouth Mooney. And we had these conversations about how to bring people into the experience of going for a treatment. So it was very performative. We got ourselves up in doctors' sort of coats. I know maybe doctors don't dress like that anymore, but we tried to create this sort of clinical, kind of the opposite of Into Her, kind of a stark, scary experience that before they came into the treatment, they would put themselves in the shoes of being a patient. So that's kind of the performative dimension that I bring to this place. And so many people reported that it really, especially if it hadn't happened to them before, but even if it had, it created that mental space, that place of, okay, now I'm going into this, and I kind of have a sense of what I'm getting into on some level. More so with Memory Mountain than Into Her. I think they just came from different places, but the performative dimension and the staging became a primary element of it.
Yeah, I'm really struck, Camille and Lottie, by how in the projects that you're describing, a big part of what you're doing seems to be bringing to patients, to individuals in healthcare environments, bringing joy, community, activity, but also there seems to be an element of empowerment and advocacy. And I'm just wondering if you could reflect a little bit on that side of your work. Why is it that in so many different healthcare spaces, there's a need for patients to have the kind of support that gives them voice, that gives them confidence? Why isn't that already designed into the experience? Why do we need to work to bring it on top of it?
It's a really interesting question, and I think it does come down to resources. For me personally, I turned to the arts when I was going through my second breast cancer diagnosis. I knew that for this journey, it was going to be kind of more intense treatment. So I started to research chemotherapy. And what shocked me was that I couldn't find any imagery around the experience of going through cancer or an illness, let's say, in any way other than suffering. And so I guess just to come back to the point of sort of the work that we do within hospitals as well, it's trying to move away from that element of suffering. And so that was kind of my motivation to do a project that really challenged, I guess, how we look at illness and the experience of illness. And I use the word illness because I think we're getting better at visibility around disability, and we talk about that, and it's brilliant and it's really important, but I don't hear a lot of narrative around illness. So through my project, I approached a fantastic photographer called Elliot, and he brought together a team of creatives, and leading up to this, I'd been creating a journal, and I felt of my experiences, and I felt the need that I wanted to challenge what I was seeing. And also being a creative health professional, I felt like I couldn't tell other people to do this. I needed to do this myself. It's important that I was prepared to put myself in that position. And so basically I broke down what were my biggest kind of experiences or things that I felt strongly about, which also challenged language around cancer. And actually one of them was joy. And that there are moments of joy to be found even in the most difficult of experiences. And I think that's an important thing to talk about, because all I was seeing and all we talk about a lot around illness is suffering. And yes, it is hard. And I guess also what is lacking, and we know it's lacking, is the emotional support, the spiritual support. And I think that's commonly why we turn to arts. And so I went on this journey, and I had amazing support from my nurse, actually, because I had a PICC line in my arm and we wanted it to be part of the photograph. We wanted the illness to be visible, but at the same time, we wanted you to almost see the illness secondary. So my nurse even came to the photography studio and wrapped my PICC line, and then came back at the end and wrapped it again. And that's a beautiful dynamic and relationship with healthcare professionals. When would you ever think that that would happen? And that's what creative health has the power to do.
And that leads to my next question, which is I'm really interested to hear more about how medical staff, nurses, doctors, hospital workers, how do the people who work in healthcare tend to respond to your projects, your interventions, the experiences, and maybe even the disruptions that you bring?
One of the things that I discovered, two different kinds of circumstances, I guess, in the context of reproductive health, the response was kind of like, get rid of everything, then we don't have to deal with this again. And for me, that was not helpful. One of the women who is the voice in Into Her put it the best. She's like, that's like saying, why don't you cut off your arm in case one day you get an infection? So that kind of perception about reproductive health, I feel like that has to change. But when a lot of people in that space came to see it, like there was a gynecologist, there was somebody who was teaching in Sheffield in the medical school there. There were a few other people who came in. They were all extremely positive and were saying things like, we need to bring this into our teaching. We need to bring this kind of advocacy and this kind of opening or making visible experiences that women are having. In contrast, Memory Mountain wasn't showing so much joy like Lottie was trying to make visible, but it was definitely trying to make, again, visible the invisible experience of going through cancer treatment. A lot of the people we spoke to and interviewed had talked about how they didn't have enough energy because of the treatments to talk about what they were going through, because it would cost them more energy to explain or even to take care of the people around them who felt bad about what was going on. So when they saw Memory Mountain, experienced Memory Mountain, they felt like someone, saw them or validated their experience, but also they felt a sense of connection to the stories and the other people whose stories were being conveyed. Again, we had particularly at the beginning of the project, we had someone who was desperate to get the project into an oncology, again, teaching context to help create empathy amongst young doctors and healthcare professionals, because her thoughts were that they see so many patients, they start to lose that sense of empathy. And so it's not that it's not there, but they kind of have to protect themselves with all the different people they encounter. A third thought, which is kind of addressing what you mentioned earlier, Lottie, was the sense of, especially cancer, people feel like they are really well cared for during the treatment experience. But afterward, when it's over, a lot of them felt kind of dropped off. And that's the place where something like art and health or something else needs to take care, not so much their physical health anymore, but their mental health, because they're changed. Something has completely changed, and they're not the same person they were before. And so at that point, often they have no one, because they're done, at least for that time period. Some people have recurrences, but at that moment, they're done. And so that, to me, while there's amazing healthcare, and as Lottie says, there's a lack of resources and lots of levels, maybe they don't have time or energy or money or whatever resources to support that second part of the journey. But that's the piece where I think art can really play a role.
Yeah, and let's come back to that question of the second part of the journey. What happens when we go home? But first, Lottie, just wanted to hear some of your thoughts on how hospitals tend to respond to the work that you do. How welcoming, how accommodating, what are some of the obstacles, but also what are some of the ways in which hopefully those spaces are with you and behind you?
Yeah, I think what we try to do, well, for two reasons. A lot of hospital arts managers or people like myself in my role, we do look at how we can support staff as well. And so actually, sometimes the best way for staff to really understand this is to partake in it. So we deliver staff wellbeing workshops. In fact, New York City Health and Hospital, they focus their arts program actually on staff because they believe that you need to care for the carers first. So they don't actually prioritize the patients, they prioritize the staff. So we will engage staff in creative workshops. It helps them to understand. We've had a lovely thing happening recently where we've brought music into the hospital, and one of the wards we visit is a rehabilitation ward, and actually the OTs identified that the music that we bring in, they partake in the music making, and they observed that the music making could be part of their recovery. So we now have built into our music program music where it encourages movement, so working with the physios and the OTs. So that is a brilliant example of how us being there and showing what can happen, if you can give space for staff to interpret how they feel it can then be utilised. And, you know, the example with the music is a brilliant example of that, where the staff could see the potential. I guess coming back to the compassion fatigue, it is a big challenge. It's not because staff are not compassionate, it's because they're under a lot of pressure. And I think, and I'm sure we'll talk about this more in depth, but one of the challenges is almost we work to the ethos of do no harm, which is fantastic, but that can be restricting. So if somebody doesn't understand something, they're more likely to reject it. So it's important that we take healthcare professionals on the journey with us. And actually I've just been to this conference, National Organization for Arts and Health in New York. And one of the special moments for me was that I actually got to spend some time with some clinicians, some doctors, and to see their passion. And it's not often that you have the opportunity day to day to kind of sit down and be passionate about it. And actually, we want to achieve the same things. We want to make a difference. We want to change how our health system is. And they are interested in knowing more. So sometimes it's just purely a lack of understanding, and how do we best take them on the journey with us?
Yeah, that makes a lot of sense. And it's actually great to hear you both speak about healthcare professionals, about the people that you work with, that patients are working with, who obviously are a huge part of this whole journey. But maybe we could pivot for a moment away from people to systems, which is probably not the most exciting thing. However, I do think it's important. And you've mentioned, Lottie, some of your experiences of visiting visiting American hospitals and some of the experiments they're doing there with creative health. If we bring this back to where we are here in the UK, and we have the national health system, which, as we all know, has been really strained for many, many years, and the pandemic just added a whole new level of weight on top of that. I'm wondering to what extent the system, under the current strain, does that enable more opportunity because there isn't resource dedicated to doing this, and so it creates space for you and other creative health professionals to come in? Or actually is the strain in the system making it harder to integrate this sort of approach more holistically, systematically?
Well, I'll just speak from my experience because I've been trying desperately to connect through both nearby hospital trusts where I am, but also through the Health Innovation Network. And those conversations are still ongoing, but the beginning of that is that, yes, they're really interested, but they're risk averse, as Lottie and I have talked about before. And so they want to have reassurances. So I've been talking to a psychologist, like, can we test this from your perspective and give some kind of testimonial from your professional opinion about the value of this? I spoke to a psychiatrist another time about the same thing. And so there's that side of it. The other side is that and my collaborators, especially with Memory Mountain, have been talking more to charities, and because they often end up picking up all the extra work that the healthcare system doesn't have the capacity to do, but they're also underfunded. But their raison d'etre is more about that support side in many ways, at least in my personal experience and speaking to others who've been engaged with charities. So there's that kind of complementary system that I'm looking at. Again, Lottie has a bigger picture sort of perspective. I'm coming from the ground up, I guess, and just trying to figure out the system.
Yeah, I think one of the biggest challenges is who funds this. And the biggest tension I see is it health or is it the arts that fund this? So there's definitely tension there. And I don't think that there is a simple answer. What I would add to this is that from a point of view of systems, when we think about it this way, is that in a way, an important part is to almost empower community and individuals to find solutions as well. So sometimes systems can disempower. And if you think about something like, I find it quite fascinating. So we talk about something called social prescribing, where you can now go to your GP and be prescribed an art activity with a local community group or going on a walk. It feels a little bit like we've pulled that into the system. It already exists. So we already have all these amazing things happening in community that happen naturally and organically. You know, a little knit and natter group might start in the library. These are all things that are really good for your well-being. And actually, what we should be doing, I feel, is supporting community to be healthy, happy and well. Like, so it's a little bit, it doesn't quite answer the question, but another thing that I always think about as well is, why are we building hospitals? Why are we not getting rid of hospitals? Because if we were really good at the prevention side and we were really good at staying well and community played a big role in that, we should be closing hospitals. So it's really fascinating, creative health in hospitals and in community. And I think they are integrated and they should be integrated. But I think community has a huge and really important role to play in this, and supporting community to help solve this is well, they know how to solve it. They do it.
I just have one thing to add as well, just because I'm coming from research and also arts. I have noticed changes in funders and what they're supporting. So there's mindset funding from the UKRI that came out last year, and it's more mental health, but it's still health-based. I had a conversation with the head of Arts Council last year, because they help support Memory Mountain to go to various festivals. And she said, we're trying to prioritize art and health. And it was just when Stormer just came into government. So she was saying, we're trying to prioritize it with the government. So there is initiatives also not just arts funding, but in research funding. But again, it does go back to who's responsible for that.
But this brings us to a broader conversation about, what is health and where is health. So when we tend to think about it, mostly we sort of focus in on hospitals, medical environments where we're doing health interventions and actively treating people with acute conditions. But I think, Lottie, your point about actually, from a system point of view, there's this thing called community. We have lots of them. Many of them are quite strong, resilient, caring, empathetic, supportive, and we just need to not just support that, but also help connect people to those communities. But the fact that so many patients feel alone, and maybe when they return from hospital, that sense of isolation is maybe even intensified because now you no longer have people around you actively looking after you, interested in your care. That maybe there's something about the way contemporary society is working where we have both a tantalizing proximity of communities, yet nonetheless they feel distant and we feel disconnected from them. I'm reminded, it's a terrible segue, but I'm reminded of Edgar Allan Poe's short story, The Man in the Crowd. This man wandering in a big urban crowd, surrounded by people, yet still feeling totally alone. And so I guess what I'm wondering then is how do we bring together both the tantalizing proximity of communities and all the potential for care and support that they offer, and people who either don't know how to make that step or don't feel able to make that step. What are the blocks to us being more connected to our communities? And I'm asking that, we're sitting here in central London, a very large city, a very diverse, global, international, cosmopolitan, multicultural city, so many neighborhoods, so many different communities here. But it's very easy living in London to feel alone, even when you're part of the crowd.
It's an interesting question. And also there's a lot of research being done on loneliness and actually how bad that is for your health. It has a huge impact on your health and well-being. I guess part of what social prescribing addresses is some of that. So you may be prescribed a visit to your museum. So it's kind of encouraging you to get out there and to get to all of the beautiful things that are in your community, all of the groups that are in your community. What I do find really curious as well, and I just would like to use a quote that I heard recently, which says, "There's never been a culture without art." And what I find curious about this kind of era of like social prescribing and stuff, and it's like we are being prescribed to an art session, but it's always been part of who we are to be human, has been using the arts or viewing the arts. And so sometimes I just wonder if some of this and of what's going on is like a reminder of what it means to be human. Like we need connection. Arts is fundamental to who we are as human beings in all of its shapes and forms. So it's actually like a really big question because there's some fundamental things kind of going wrong in how we exist at the moment, that we're becoming isolated, be it technology, whatever. I mean, this could go into a 2-hour-long conversation. But I guess creative health, arts in health, is trying to address those things in some interesting ways, but it also kind of doesn't make sense because a lot of the things where you may be prescribed to are kind of there. Why are we not going there? Why are we not walking in that art gallery or that art class?
Because I use technology, I'm going to say something that might be counterintuitive to that, but I feel like, especially after the pandemic, everybody being online, everybody using social media, I feel like there's a lot that happened that took people away from each other. So, yeah, I feel like there is some work that we still need to be doing around, even though, like I say, I work with technology. The way I work with Immersive is very one-to-one. It's intimate. It's dealing with difficult topics. But there's a huge part of it is that, okay, you've seen or experienced this thing. Now let's talk about how it made you feel. And it's very much around connecting, again, back to that person on a one-to-one level and tapping into what has happened for you and how did it make you feel. And I think more of those kinds of bringing people together opportunities are necessary now because the things are out there, the opportunities, the art, everything is out there, but we have to pull people out of their homes and find ways to do that. And There was one man who was we interviewed in Memory Mountain who had breast cancer. He was a farmer, completely isolated in Ireland. And the only way he saw people was when he went in for his chemotherapy treatments. And this is how we found him, because my collaborator met him during her chemotherapy treatments. And he was so on his own, no partner. His daughter was far away, that he checked himself back into the hospital after his chemotherapy because he was worried he would collapse or something would happen to him on his own. So there are people like that who are also, by their nature of their job or where they are in the world, are automatically geographically isolated. But the everyday person in our world right now is isolating themselves on some level. So it's figuring out techniques to bring people back to each other and to find each other.
So let me paint a scenario, which is obviously quite extreme and absurd. But here's the scenario I want to paint. Are we headed towards a world where you have a large hospital room with 12 beds, each person sitting there with a pair of virtual reality goggles, and each person is on a completely different individual experience. One person is on vacation in Hawaii, another person is having a birthday party with all their families back home, and a third person is at the zoo playing with penguins. Maybe you're off-world on the moon. But whatever it is, that you could sort of be trapped or alone in your own isolated escape, and that this is a way to kind of, overcome the experience of being in a hospital or the experience of being home alone, a way of processing or dealing with fear, anxiety, but at the same time, something that keeps us separated from each other.
I mean, my immediate response would be to do that responsibly. After everybody's session, someone would come in and have a conversation with those people, and they'd all share their experience. In the work that I'm doing, the offboarding, the after, the debriefing is just as important as the experience itself, really. And sometimes more so, because in some ways that experience is just a conversation starter, and afterward, that's where the work, the action might begin. And my hopes, again, for Into Her were that all these women know more about their bodies and they go out and talk to their doctors, and they go. Similarly with the breast cancer issue, that more women and men go out and talk to their doctor, but also talk to each other. So my response to that is that it's only a beginning. It shouldn't be the end.
Yeah, it's like viewing it as a part of lots of different things. I mean, there's definitely value in that, like the opportunity to escape, to have a positive distraction, absolutely. But there's so much in peer-to-peer support. And I think, as you identify, when you finish your treatment, it's a very difficult time. And I've been honoured to be part of communities that have gone through cancer. And it's a very special community. And it's this thing about being able to share your story, isn't it? And the work that you do, Camille, that's understanding people's stories and those people that have had an opportunity to tell the story. And that's what I needed to do in my work, was to tell my story. We need to keep being able to tell our story, and we need places where people can hear that.
Well, when I had my tumor, I went to a geneticist to see if it was genetic and so on. And the geneticist said, no, you don't have any of these genetic markers. It looks like it was something rare, et cetera, et cetera. But she said, 1 in 2 of us will get cancer. And I didn't realize at that moment that it was so high. But also, more people are living. So, yeah, we need to address it as a society, like we need to address death, in a more positive and a more life-affirming way, and so, if that makes sense, in a way that is bringing people together, bringing people to support each other. Actually,
we were having a conversation prior to this, weren't we? And we started to look at where the other spaces are, where this should be happening. Not always in galleries, not always in museums. There's lots of great things happening around creative health in museums and galleries now, which is fantastic. But, we've got where are those other spaces so even more people can access this? It's always about breaking down the barriers, I think.
Yeah, with Into Her and Memory Mountain, I had some creative partners where we put the projects into shopping malls, into parking garage, other places where people just be passing by. And that was so amazing because you got people who would never seek out, never tried VR. Some may have been interested by the topic, so they came because of that. But those experiences, those people, what they reported back was so much more interesting to me than the people who came to see it at the festivals, who were more picking apart the technical or the creative dimensions. Those people were having authentic experiences, and we do need to take it to them as opposed to expecting them to find us. For sure.
I mean, part of the issue about why has art been, taken out of schools, taken out of our daily lives, and put behind walls, in museums, in high cultural spaces, in expensive spaces, in spaces that not everyone feels comfortable and able to access. I think there's a lot of work to be done, and creative health might be one of the really powerful, impactful ways of doing it, of kind of redemocratizing art at a time when that's super, super urgent in society. And there's also the question of your kind of position in relation to the work of creativity. So art being done to you versus you making art or being part of the creation. And we've heard examples of lots of different ways in which to bring art into health environments. And as you say, Lottie, being open to the full range that can take, and being open to what actually makes an impact on an individual, what speaks to them, what helps them, what makes a difference for them. And we shouldn't assume that everyone responds to the same things. But within that, I get the feeling that having patients and as well as staff being more on the participatory side of that might be where to place the emphasis. What do you think?
Yeah, so we talk a lot about co-production, which is complicated. It's really important to do, but it's complicated to do. So, for example, when we develop a therapeutic environment, because also we're really keen to use that language therapeutic environment, so it takes away that core focus on the art, because then you do get stuck in those arguments about what should be there. So we go, okay, what would the therapeutic environment need to be? But we are going through a phase of hospital modernisation, and what's really important is that, you want to bring the lived experience with you. So, the ideal situation, if you are developing a space and you want to bring art into that space, you want to create therapeutic environment, you need a steering group, and within that steering group is lived experience, is staff, is artists, is everybody, and together you create the creative brief. And then the artist that is commissioned has to deliver on that brief, and that committee will keep that artist in check to make sure that they do that. So it should never just be about a curator coming in and doing it. It has to be co-created. And that's the same with really any impactful creative health intervention. You should build it together. It's a tricky thing to do, to get it right, but it's a really, really important thing to do.
And in a way, this makes me think of the hospitals of the future. Earlier we talked about maybe if we're getting health right, we would have fewer hospitals. But as a place to kind of draw our conversation towards a close, could I invite you to just imagine a little bit, particularly if you had the ability to shape that future, what would hospitals look like in the future? And I asked that question having recently walked past a kitchen store. And it struck me that the way that kitchen designs are going, kitchens now look like everything except kitchens. Right? They look like libraries and art galleries, but there's no evidence of food and cooking and all the stuff that we traditionally think should happen in a kitchen. And I'm not saying that's a good or a bad thing, but I'm just wondering if we really want to kind of stretch our imagination, what would an ideal hospital of the future look like? And maybe it's something beyond the category of a hospital.
I'm not terribly great at speculative futures, but I mean, when you said that, the first thing that came to mind was something that might be more akin to a playground, but also something with lots of comfortable chairs and lots of small, cozy spaces, and somewhere between a playground and a classroom, but for adults.
I love that, a playground and a classroom for adults.
Because there's lots reconfigurable spaces and lots of materials and things that are not just about, like you said, not just about health and getting better, but communing and making and doing and relaxing and those kind of things. That's my immediate thought about that.
Yeah, it's interesting because the NHS has released its 10-year strategical plan, and it's that we go into more of a neighbourhood model. So there's community hubs that are being developed where a GP may sit within that space, and then some things that may have taken place in a hospital can now take place in that community hub. And the idea is that it might have a cafe that's run by the community, and creative health is integrated into every element of the patient pathway. So I think art being available, creative health, VR, technology, anything that helps us to tell our story to make our experience better, for me, should be part of all of the pathways. I think the community has a massive part to play. And the other thing that I'm really passionate about is not only what it should be, but how we get there. And for me, and I learned this massively from when I did my Churchill Fellowship, sharing knowledge is so vital, and doing this together is so vital, because there's so many of us that are trying to do this work in silo. So again, that's putting pressures on the resources and the funding. And if we work together, and we do this together and we share knowledge globally, like we're all dealing with the same, well, some of the same health challenges. So why can we not work globally and try and solve it? And because this would speed it up and it would save resources. So I've become hugely motivated by this idea of collaboration, sharing knowledge. Let's solve this together. And I'd like to think that in return also helps some of the divisions that we're facing, and theoretically builds more connection and more access to this. So it might sound like quite an idealistic vision, but certainly when I work on a small island, and I'm fascinated by building an islands network, because it's unique again for islands. It's a different health system, or rural communities, or seaside communities, or communities that have indigenous communities and strong heritage. It's like it all has a place. But I just think sharing the knowledge, like we're doing today, we're sharing our knowledge, our experience. To me, that's really important.
Yeah, that's a really beautiful sentiment. And my hope is that we have listeners who are thinking to themselves, I want to get involved in creative health. What advice would you have for anyone who would like to actually explore a future as a creative health professional? How do you get into this field? And what do we need to do to support the field?
Well, again, I'm going to say something really quick and then pass it over to Lottie. But I would think that a lot of the people who get into it do it like myself because something has happened to them or someone they know. So that's coming from a place of passion and personal, but then it needs to spread out to being not just about yourself and about how you can connect with others. So I would say for artists who want to, they should do it. But then the next stage is finding people like Lottie to connect with. I think that's the more challenging part.
I think you're right. I think it is about, if you have a passion for it, seek opportunities to explore that as an artist individually. The pathways into creative health, I guess, are a little bit complicated, but obviously, creative health exists in communities, so it's delivering projects with community, in community, so that could be something you develop yourself or with other grassroots organisations. A lot of hospitals do have arts managers, so reaching out to arts managers. And I think looking at things like the Centre for Creative Health, their website, keeping an eye on what's kind of happening. I know this isn't necessarily the subject we wanted to go into, but it is also an area that is still a little bit complicated around professionalisation. There isn't any sort of certification for this. So it is about kind of getting out there and trying to learn as much as possible. There are things like the Creative Health Quality Framework. That's really interesting because it helps to sort of dissect some of the key principles about working in this field. But a good place to start is always that passion and that personal motivation. And then just kind of keeping an eye as to what is going on out there.
And on that note, I really want to thank you for joining us today. So thank you, Camille and Lottie, for sharing so many ideas and being so open and generous with your work. And I also want to thank our listeners, and we hope you'll join us soon for more episodes of the RCA podcast.
This podcast is from the Royal College of Art, home to the next generation of artists, innovators and entrepreneurs, and the world's #1 art and design university. You can learn more about our programmes at rca.ac.uk, as well as finding news and events relating to the college and our application portal if you're interested in studying at the RCA.